graded task assignment. It's a useful technique when your client is overwhelmed by a huge project or huge thing to do. Or it doesn't have to be a huge thing for you, but it could feel huge for the client. And then you break the task down into smaller tasks and make a lot of small deadlines. And then you kind of, in this case, it's very much like you are being a nice life coach, and encourage them, check the progress with them, and then try to change the plan to find a better way to carry out, and always give them positive regards so that they can remain encouraged. It's very useful for graduate students who are struggling with big thesis project or any other big project they have hard time with, or some clients who tend to have huge procrastination issues, tax report. Although I remember one of our psychiatrists in my Center for Anxiety-Related Disorders. He was such a gentleman psychiatrist, and he does CBT. And then one day he was in the cover of Boston Globe as the biggest procrastinator in the city, because there was the tax report due date? 15th. April 15th, right? And he's like pulling his hair out. I don't know, I think maybe he thought it was funny, but the Boston Globe interviewed him, and he was saying, I don't know, I can bring myself to do it in time. Every year I get extension and I end up doing it in the last minute. So for some people, even for the psychiatrist who does CBT, tax report could be a overwhelming task. So all those kind of overwhelming long-term tasks, you can use this graded task assignment technique. And you can begin with identifying automatic thoughts about the task. A lot of people tend to have all or nothing kind of thinking. Graduate students who struggle with the thesis, they tend to think they have this huge fear of writing a poor thesis. They should change the framework that the best thesis is done thesis, but instead, I'm not going to even write if it's not going to be a great thesis. All or nothing kind of thinking. It makes them really, really anxious. They wouldn't even start writing the first paragraph. Or catastrophic thinking. They, tend to think that they don't really have resources and it's going to be a big disaster. So all these kind of automatic thoughts you want to work on, and then you reward your patient whenever they finish even one small step, and then you kind of go along with the long-term project with this way. That's one of the behavioral techniques. And the next one you could also very easily use in the therapy session is a behavioral rehearsal. It's like role play. So any behavioral plan you make with your clients, if it's scary for them, or if they feel like they are not very confident about doing it, then that's always a good idea to practice it in the session. So one example here is being assertive in communicating with others. So you want to start with a general idea, and then help the patient shape his idea into a clear statement. And then a lot of people are afraid of being assertive because when they are afraid of hurting the other person's feelings, upsetting the other person, and having worse consequences. So kind of teach them simple technique, like use the good news, bad news, good news method of communication. It's sometimes called sandwich method. So say positive things first, and then say your core statement, which could be bad news, and then you end with positive notes. So teach this kind of technique, then the client will feel better about, okay, I don't have to end with bad news and make the person really upset. And then you do the role play interaction in the with the patient in the therapy session. You can do 3 different sets: the best case scenario, the worst case scenario, and the most likely scenario. So you can do the 3 different sets and talk about how he's gonna cope with it. And then also you could discuss the prediction, because the patient will know best about what is likely to happen. Because if it's about being assertive in the workplace, the therapist doesn't know the boss, the patient knows the boss. So the patient can make some predictions, and then they can talk about the anticipated outcome, and also help the client to choose the best time and best place and best way to prevent negative outcomes. So you can prepare your client a lot by doing role plays and doing rehearsals and doing the anticipated troubleshootings, so that way your client by the end of the session will be more confident about going out there and doing it. So that's one of the behavioral technique. And the next one is also pretty simple: problem solving. One thing I always like to warn is that you don't want to move to problem solving technique too prematurely, because people want to be understood first. They want to talk about their feelings first, and then they want to solve the problem. A lot of times actually people know solutions. They may not be good, but they have some solutions in their mind, but they still want to talk about their feelings. They still want to talk about their anxiety and fear. They still want to have the time to be understood, and then they'll become ready to talk about solutions. Yeah, so know the right timing to go to the problem solving mode and use this method. The things you need to look out for is people tend to have these kind of obstacles. Although they have all the intellectual capacity and resources to reach solutions, they are kind of obstacled by some cognitive impairment. People with depression, they have the most terrible time making any decisions. They tend to be incredibly indecisive. So that's part of the symptoms. So you need to watch out for those kind of impairment. And then emotional overload. They could feel overwhelmed, dysphoric, and anxious. I've seen plenty of people who are perfectly fine in other areas, and then only one focal area, they just behave weirdly, because that's the area they feel overwhelmed emotionally. They feel anxious, they feel less confident, and then it can become the obstacle of problem solving. And then cognitive distortions, as we talked about a lot, their thinking process, cognitive errors could be in the way. Avoidance could be a big obstacle. People procrastinate because they are avoiding some confrontation. People forget. It's kind of passive aggressive behavior of avoiding. There are a lot of social factors. People may have hard time finding solutions because they are new to the area, lack social support, lack resources, or they are criticized too much by other people. And there's practical problems. They don't have time, simply, or their resources are limited. problems are sometimes being beyond control. There are strategy factors. The person is a perfectionist. They want to find the perfect solution that can solve all the problems at the same time, making everybody happy. Those kind of solutions don't exist. In that case, you want to do some cognitive restructuring. So these kind of things can be obstacles. So you can kind of use cognitive method to remove or reduce these obstacles and reach the more effective problem solutions by the client. So that's the first chapter.